Welcome, everybody. My name's John Millen. Today on this webcast, I've been doing this the last couple of weeks. Today's topic is going to be turning OPEX, which is a big fancy word, right, into profit, which is not so fancy. So I appreciate you joining. This is going to be fairly quick. I'm going to go through a couple things. So what's the purpose of this webcast? Like, why talk about this? Because this is the language of business, whether you're a for-profit or a nonprofit. The financial statement, the financials of a company is the language of the company. And if you've ever watched the show Shark Tank or The Profit, Marcus Lemonis, or maybe Bar Rescue from John Taffer, you hear these terms thrown around. Now, it doesn't mean you have to be the CFO to be informed about this, but I'm going to give you a little bit different viewpoint about how you can look at your benefits and your health care when it comes to this. And so what I'm going to do is I'm going to take my face off the screen so I can concentrate not on that, but on this. So first, my huge disclaimer, you need to do your own research, right? It's subject to interpretation. This is based on not just, I wouldn't say just my experience, but lots of experiences that I've picked up. Right? I don't know everything. But I surround myself with people that know a lot more than me, and I'm always learning. And I might say something a little bit wrong, so just check me on it if I get off track, because I am not a CPA. My wife Laura is a retired CPA, so she has this stuff down cold, and I'm still kind of working through it. So just understand that. But we've been around a little bit. We've got a lot of experience. We've seen lots of different situations. From companies and employees, and we have become sort of benefit hackers, right? We're looking to accelerate the things that really work. They're hacks. They're shortcuts. They're not illegal shortcuts. They're just things. Hey, have you tried this? And we have a fair number of clients that rely on us every year as their advisor. Some in a very small way, some in a very large way. Several $1 million spend, some $10,000 spend. So with that, let me get started. Let me get right into now. Do not fall asleep. I know you just had lunch or maybe eating lunch, but this is the language here. So if I were speaking in Spanish, buenas tardes, ¿cómo está? Like I did today at a group meeting, I had some Hispanic workers there, and I said, good morning, and I said, buenos dias, and they popped up, they chirped up. They're like, "Whoa, my God, this guy knows Spanish!" And so I had a little bit of a discussion with them. But this is the language of finance, and so I want to very quickly. This is not going to be a CPA exam after this, but very quickly, what do these terms mean? Now I will tell you after you understand these a little bit better. You will, when watching The Profit or Shark Tank, it will be amazing because you're going to be like, "Hey, that's you're asking for 50 times earnings." 50 times EBITDA, and you're going to catch this stuff, and it's really important. So first, revenue. You have a big bucket, or you have a big bathtub that's empty, and the spigot is spilling water in with the drain closed. Think of that as the top line. That's their gross sales, the revenue. It could be reimbursements. It could be grant money, right? If you're a nonprofit, maybe it's not, you're not selling a product, but maybe it's reimbursement from Medicare, Medicaid, grants. It's the top of the line, the top number that drives your organization. Okay, so you start there. Then you start subtracting pieces off of that. One is operating expenses, or OPEX, or OPEX, also called SG&A. You'll see that term floating around. SG&A, sales, general, and administrative costs. Now, sort of kind of the same thing, but basically these are the costs of running the business. So you have rent, you have a mortgage on your place where you work, you have salaries, you have benefits are in there, lots of different stuff. That's the cost of just kind of turning on the lights and running the business. That's your operating expense. That's what we're going to talk about today. Then you subtract your costs of goods sold, or COGS. So if you sell a physical product, like maybe you make envelopes, this might be the cost of the paper, the cost of the ink, staples, and so forth. But you might be a service-based business. So you may not have physical materials you're buying, but it could be labor. If you're providing that service, it could be things, resources you're using, fuel if you're driving trucks, right? So these may be different types of costs for you, but those come off. What you're left with is gross profit. All right, so this is not, this is usually on the income statement, and basically after you've taken out the cost of making or providing or running the company, this is kind of your gross profit. This is kind of the first level of what's left. What do I have in my bathtub? The water's been filling up, but there's a drain open on the bottom that's pulling stuff out. Another term that is very similar to gross profit is EBITDA. Now, throw this term around this weekend at a party. Hey, what's your EBITDA? You're going to have some good fun with that. EBITDA, earnings. So this is earnings. So essentially your profit, your gross profit, before you pay any interest or you get taxed on that money, right? The government likes their taxes, or you depreciate or amortize any equipment. It's that number before you take that off. This is the number that typically you hear a lot, like on Shark Tank, like what are your earnings or what's your net margin? These are numbers that they're calculating what the business is worth. You're talking about multiples, but EBITDA is almost pretty close to what you have left in the bank after you've paid all your expenses, but not quite, right? Because you haven't paid taxes and other things. Then you got net margin all the way down at the bottom. Everything's squeezed out. It's either going to be in a number, or a lot of times you hear this as a percentage. Like we operate at a 5% net margin, or we operate at 10%. I don't know what the average is. I have to ask Laura. I think, depending on the kind of business, it's anywhere from 3% if it's a high volume kind of industry to, some tech companies might be 50%. And so it's expressed typically as a percentage. But this would be all the water's left the bathtub. What do I have left? All right, I bring in $1. At the end of the day, all this stuff comes off. I'm left with $1 that's actually tangible that I can do something with, to like maybe buy some new equipment or hire a new employee or give a raise. That money typically is going to be about 10%, let's just say. So you make 10, you make $1, you take 90% off, you're left with 10%, you're left with 10 cents. So wake up if you fall asleep, but this is really important. And just to kind of you don't need to be a CFO, I don't think, to understand this. And so you just need to understand kind of what is this telling? What is the story? This is the language of the business. And I don't care if you're the HR manager, CFO, or owner. If the businesses aren't profitable over time, what happens? Everyone suffers. So we all get penalized. It doesn't have to be your job to count the pennies or dollars. It has to be our job to understand what story is this telling. And what I'm going to show you today is hopefully a different way of seeing this story. So with that, there's three key points. Why should you care? Hopefully you understand why, but I'm going to talk about a couple reasons that have changed dramatically with COVID that will accelerate. If you didn't think you should care before now, you might after. What can you do about it? I talk to business owners, CFOs, HR managers every week. And sometimes I hear that, John, there's just nothing I can do. I've just conceded 10% increase in my healthcare. I've just conceded. So if that's you, there might be some things you just don't know what you don't know. And so there are some things, not for every company. We're not magicians. We don't have all the answers to everybody, but there may be some things you can do. And then how can we help? So if you want some assistance, we can help you through that. So first, why should you care? You can read this quote from Gartner. This is just from April of last year, 2020, that SG&A, right, your OPEX, your expenses, need to make cuts because of COVID disruptions. The COVID pandemic, I'm telling people, is a wake-up call to the status quo. For years, companies have been like, it's kind of the way it is, not much I can do, but I've survived the last 10 years or 5 years or 2 years or 20 years or 30 years. My suggestion is things have changed quite a bit, and I'm going to show you. One, the top line, that gross sales, that top number, whether it's selling a product or funding, if you're a nonprofit or you get grant money, wherever that money's coming from, you're providing a service, might be constrained. So my whole thing is about, don't look at your planning for benefits on a year-to-year basis. Don't wait to 2 months before your benefits renew to find out they're going up in cost and the coverage is going down. You need to maybe look out for 2, 3, 4, 5 years. This is the GDP. This is the U.S. United States gross domestic product. This is the sum of everything sold and purchased. It's like what's going on in the country. I mean, a third of it disappeared last year. That's ridiculous, and it may be a while. So this may continue to be hampered on. If that top line gets smaller, it squeezes everything in between. Second, the cost of goods. Lumber is just one of them, and I'm sure you've seen this on the news. Lumber went up in January of 2020. According to this graph, it looks like about $400, whatever this is, price per 1,000 board feet. Okay, great. It's $400. Now it's 15. That's 300 to 400% increase just in lumber. What does that do? That's eating right into that gross profit. It's coming out of that top line, and it's really hitting some companies and organizations hard. Now, you might say, hey, John, I don't build houses. I don't care. One of my customers is looking to build a new headquarters. The initial estimate was $1.5 million about 18 months ago. It's now $5 million. The cost tripled to build the building for the company. So you may not think it affects you, but they were looking to expand, and now they have to pay 3 times as much because of lumber and steel prices. So this could be pressure. Let's talk about healthcare. Healthcare, and I'm talking about medical. Certainly you have dental and all your stuff. You have 401ks, salaries, all that stuff's in here. I'm just picking out the healthcare piece. 8 to 12% annual increases. You have seen these charts. This is not new information. And what's even worse is not only do the costs go up for you, the employer, they go up for the employees, and the coverage gets worse. Nothing like getting an 8% renewal increase and your advisor, your broker says, hey, that's not bad. It's better than 15%. But then, oh, by the way, the out-of-pocket maximum went from $6,500 to $8,500. Oh, by the way, your cost sharing, where you were just paying 20% of the bill after you met your deductible, is now 50%. But it's not bad. This has been an escalating problem, and according to Kaiser, and this is where this came from, over the past 20 years, it's averaged 12%. So that's an impact. What about labor on your operating expense? $15 an hour minimum wage. Why? Some states have enacted it, yes, but shortage of workers. Now, we could debate all day long about what's triggering this and what should be done and what shouldn't be done. I don't know. I'm not going to get into politics. I'm just saying, whoa, look, the person making $10 an hour now at Wawa is being paid $15 now because they can't get workers. They're paying signing bonuses. So this is eating into that. And one thing I think about, if the floor goes up from the current minimum wage, which I think, I don't know, what is it, $5, $6 an hour, $7, whatever it is, to 15, does that put pressure on everybody else above the line? Like, does that mean someone making a $30,000 a year salary will now be offered in other places $40,000 or $35,000? So I don't know what's going to happen, but I'm saying this is putting serious pressure on those numbers. So now that you're all in a good mood, I'm going to show you what you can do. A couple things. One, understand that this is changing pretty fast. In the past, change what maybe wasn't so fast. I don't think this is new information, but it's changing quickly. Number two, I'd say you can do some things about it. Now, there are cases where there's not a lot you can do, right? You have 3 people on your medical plan, your rates went up 12%, not a lot you can do, realistically speaking. But you got 50 or 100 or 200 or, I was talking to a company last week. They have 265 people on their health plan spending $2.6 million. There's some things you can do. Third, you got to have some courage. You got to do something different. You're going to maybe push back against your employee base when you go, look, we need to make some changes, and this is why, and this is what it can mean for you. And so you may need to do some things a little differently, and it's hard sometimes to have that change. So here's the first thing that I would suggest is figure out just on your healthcare what that financial impact is going to be 3 years from now. So I'm going to pretend like you spend $1 million on your healthcare. All right, let's see if this cooperates. 1, 2, 3. All right, here's your $1 million. Now I'm going to assume a 12% renewal over 3 years. It's going to compound at 40%. You're like, wait a minute, 12, 12, 12, that's 36. Why is it 40? Because it's compounding 12% on 12% on 12%. So over 3 years, it's 40%. So what I want you to do is take your total healthcare annual costs, not just your medical, but your health savings account. So any money you put in and your employees put in, because that's going to offset expenses. Health reimbursement arrangement, secondary insurance, gap insurance, add it all up, multiply it by 40%. So in our case, now we're up to 1.4 million. This should be pretty easy math. Your numbers may be higher than this, maybe lower. So here, now we're at 1.4 million. All right, no problem, John. I got it. All right, here we go. This is your spend. And probably along the way, the coverage got worse. The deductible probably went up, copays went up, prescription coverage, skinny networks. You need now a referral to see a specialist, all kinds of stuff you can do along the way to tinker with this, but it's still going up. So now we're going to figure out how much gross sales. So your spend is 1.4 million. It'd be easier this way, maybe. All right, so in 2024, we're talking, what do you spend? You were spending $1 million. And how much did your expenses go up? Some easy math. 400 grand, right? All right, John, what the heck are you talking about? What does this mean? All right. Now I want you to take that number and multiply it by 10. Take this 400,000 and multiply it by 10. Why am I doing that? Well, you can't say anything back because everyone's muted. But if your net margin, if your business operates on a 10% net margin, then you would have to generate $4 million of new sales to offset that operating expense that went up, this piece right here. If you operate under a 5% net, then that would be 20. You follow my math here? So I'm just saying, let's pretend it's 10% net margin. You need to generate new sales, new revenue, new something, top line, just to offset that increase. And this is the story we're trying to tell. Look, you've got this money in your operating expense that we want to free up, and we want to put it right to your bottom line. I'm going to show you how we do that. So your current spend, back to $1 million, right? So we're back here today, and you're talking, and we're like, okay, you got $1 million. One of the first questions I ask, how much is your annual spend, and how many employees? And we got $1 million, and we got 100 employees on it, so we're spending 10,000 PEPY. It's a very important number to know. What is your per employee per year metric? You take your total costs, everything included, right? All contributions, you divide by the number of employees on your medical plan. You don't count the spouses and kids. You just say, hey, we got 100 employees, we got 60 of them by themselves, we got 20 with spouses, whatever. Divided by 100, and this is your per employee per year. That's your cost. If you're paying more than $7,000, $8,000, you are probably overspending. So what we do, we come in and we say, all right, let's give you some new ideas, and just conservative, I'm going to reduce that by 20%. However, the big key here is we're not going to change your coverage. We're not going to jack everyone's deductibles or go to a skinny network. That makes it worse. We are going to keep the benefits the same. No worse. And in fact, we make them better a lot, but people don't believe us. So I said, all right, no change in benefits. So that savings, 20% of $1 million, is 200 grand. When you do that, month one, where does that money, so that's what, $15,000, $16,000 a month, $17,000 a month? That is money, that's profit, that's sitting in your operating, that goes right to your bottom line, right to EBITDA, to your earnings. Because there's no cost associated with freeing that up. You're making some adjustments that I'll talk about, but by making those changes, and again, no reduction, we're not We're not making the employees all mad and losing people. In fact, we may make them better so that they stay. We can attract better employees, but that gets interest-free working capital right into your company. What would you do with 16 grand a month? And this is paid monthly, because as you pay your costs monthly, the savings is monthly. So you don't have to wait for a year for this to show up. It's 16 grand first month. I say, you can hand it to the insurance companies, or you can keep it and do some other things with that working capital. And I'm sure a lot of companies know where to spend that money. So here it is, big picture. You spend $1 million, we save 20%, 200 grand goes right to your bottom line. It's the equivalent of getting $2 million in new gross sales. And so the reason we're talking like this and we share this is if you're in a human resources or CFO and you're talking to the owner or president, a board of directors, this changes the discussion from what's our deductible and how much is our benefits going up to how can we free up interest-free capital in our operating budget and put it right to our bottom line without sacrificing coverage. And that then leads me to how do you do this? There are many different things you can consider, and I will tell you that they don't all fit with everybody. There are certain tools that make sense for some that don't make sense for others. You hear a lot right now about, at least in my industry, they're throwing around funding types. Are you fully insured? Are you self-insured? Are you level funded? Do you have reference-based pricing? Do you use a captive? Do you use a consortium? Those are funding mechanisms. Those are risk profiles. That is a tool that we can use, but it's not the only thing you can do. It's not a silver bullet to fix what might be happening. One thing we do right away is that we use a fiduciary pharmacy benefit manager. The term fiduciary is sort of in quotes because if you have a 401k advisor that is a fiduciary, they are beholden to you and not the investment company. The same thing happens when you have vendors like pharmacy benefit managers that control most of the profit that's in the cost of drugs. They are controlling it. And here's one simple little example. Humalog is insulin. This is from one of my clients. Their claims, this is the cost hitting the medical plan per script, is over $800. I've seen this down on another company, it was $550. The cost to manufacture Humalog is about $220. So that's 300% markup, and that is hitting your claims, which is determining how much you pay per year. Your cost and premiums in healthcare is driven 80% of that driving factor is claims. It's the amount of claims coming in. So one way we reduce this is we use a pharmacy benefit manager that says, I'm not going to charge your plan $800. I'm going to charge it $350. Or it'll be a flat PEPM fee to write it. That's one. You also can improve the benefits along the way by reducing the copays, or even on tier 4 drugs, we can eliminate the cost. So there's no cost for Humira. There's no cost for Humalog. These other real high dollar drugs, we can eliminate that. Now, pharmacy is the fastest growing area in your spend. Right now, it's about a third of your claims. One of my clients, we just pulled their report. It was 80% of their costs were pharmacy. And so there's lots of different things you can do, and there's not a lot of disruption when you change this because it's simply a code number on the medical card. It's the BIN number. Pull out your medical card if you have prescription coverage and look for something that says BIN, a 6-digit code. That's what the pharmacist codes in. That's what triggers all this expense. We just change the code. So it's very simple. We can also lease networks. So talking to a group like, hey, we don't like United Healthcare, we love Anthem, or we want Care First, or we love Kaiser, or Cigna's great, it doesn't matter. You lease their networks. We can use their existing networks no matter which one makes sense, so we have flexibility on which network we use if some are good in some areas and some are not so great. The other thing we're doing is putting some companies in a private healthcare group. This is a group, it's a block of about 100 companies that get screened a little bit going in, and they get part of the risk pool. It's a way of managing the risk. It's not a consortium, it's not a captive, but it's a private group that some companies can really benefit from the overall run rate of the other members. And you even have direct contracts like imaging centers where you set up certain discounts where, hey, if you need imaging, it's no cost if you go to these 5 centers in your town. But if you don't want to go to those 5 and you want to go to the one in the hospital, it's $400. And it starts driving behavior because it's free, and we're saving so much money with these direct contracts that we can afford to pay the fees up front for the employees. These are just some of the things we can do. I could talk more on this, but I didn't want to get too deep. These are a couple ways we can help. If you're interested, I can run a 5-year projection, give you kind of an idea where we think things are heading generally. We can do a pharmacy savings. We can do a network analysis. We can even look at custom plan design. So with that, I am wrapping up. Lastly are some resources on our website, millengroup.com. We have some videos, some articles, podcasts that we do with a lot of content and information. And lastly, I would say, hopefully this has been valuable. If you want a copy of this, just let me know and I'd be glad to send it. Lastly, I would say this, why do you care? What can you do about it? And how can we help? Just be aware that these are new times with COVID, and it's important that we understand that. And there are things you can do for most companies. Sometimes you can't, but a lot of times you can. With that, I'm going to wrap it up. Thank you so much for attending. Hope you have a great weekend. And if you have any comments or feedback, my email is below. Feel free to let me know, and have a great day.